briefly describe your financial approach. How do you run your practice financially? And what I mean by that is the business, not just the business model, because we talked about the business model. It's more than that. How do you structure fees and services? You have care plans, one-time payment stuff. How do you package it? I guess I would say.
So we have a mix. There's a couple of, we're not in network with all insurance providers. We're actually in network with a couple of large ones. And so there's a mix with our care plans. I've never been one to favor someone prepaying for a year of care. So we do have some cash-based service options that you can do on a monthly basis because, we're regularly reevaluating someone, and I can't say where you are today, where you're going to be in a month, where you're going to be in 3 months, without really, evaluating it and seeing how your body responds. So I've never been a big fan personally of charging someone for a year of care. That's just not, that's never been my bucket. And, because we do advanced therapies that aren't covered by insurance, many of our patients are either paying cash, putting that on a card, or using, care credit or smart health pay for those. But we still have a mix with, a few of the patients with insurance. And we also do some federal work comp. So it just depends on what we're recommending for that patient, what condition they're coming in with, and all of that's going to vary.
Gotcha. When you say advanced therapies not covered by insurance, what would they be?
Okay, so if you're looking at regenerative therapy, and insurance does not cover that. They don't cover the laser therapy. We do see quite a few patients with post-surgical rehab. And so, if you're any modality that you're using, or anything that you're offering that's not decompression therapy, that's not covered by insurance. But we are able to, on those, we have a, fee based on the actual service. So if they're doing, some biological injections, then depending on if it's one or more joints, there's a fee for that. If they're doing decompression therapy, I thought I turned that off. For that. Okay, I'm getting a notification that my mic, can you still hear me?
I gotcha.
Okay, so with the decompression therapy, and I follow research with everything. So with decompression, it's been proven by research that it's 18 to 22 visits are what are effective to heal a disc. And so, your packages are going to be based on that. So, and then we have some patients, who, of course, if they're a Medicare patient and they want to do therapies because Medicare, covers on the chiropractic side, the adjustment only, you have your ABN form, you let them know what those services are, and they may, pay up front for pay for their therapies, per visit, on a per visit basis. So I'm more of a per visit type person, unless it's our decompression, or if we're doing a 10-pack of laser sessions or something like that, cold laser. But for the most part, I am a per visit charge type practice. Collect at the time of service. Okay,
that's good. And that makes sense. That's what most people should be doing. Owing people money is such a bad thing, not you owing them money, them owing you money. It's such a bad. Oh, so many problems come from that.
Absolutely. And then
Um,
there's also, I just wanted to touch on, different states have different laws as far as cash practices are concerned. And if you're charging $5,000 to $7,000 for a year of care, you're really supposed to put that money in a fund and pull from it on a per visit basis for that patient. I don't know how many docs, are really doing that, but you want to make sure if that's your model that you are actually obeying the laws in your state when it concerns to those types of transactions with patients.